Hello, I hope you're having a great week. Last week, we talked about physical activity and how to overcome some of the barriers that arise after having a baby and trying to start physical activity. This week, I really want to focus on some of the safety aspects that we need to consider when doing physical activity after having had a baby. As a quick recap, the Canadian Physical Activity Guidelines recommend getting a minimum of 150 minutes of moderate intensity physical activity or 75 minutes of vigorous intensity physical activity each week. This is true during the postpartum period too. Let's break it down into a slightly more manageable number. 150 minutes per week would be the same as getting about 30 minutes of moderate intensity activity 5 days of the week. When we put it that way, it may not seem quite as overwhelming. It's also very important that we engage in muscle strengthening activities 2 or more days of the week. Postpartum women may need to take extra precaution and should seek medical advice before trying to achieve these recommendations. So it's really important that you get that clearance from your doctor in that postpartum period to ensure that you are engaging in physical activity in a safe way. Okay, so how soon after having a baby can you safely get started with exercise again? The American College of Obstetricians and Gynecologists suggests that it's okay to gradually start exercise as soon as you get the go-ahead from your OB or midwife. When you feel ready to exercise, it's very important to not overdo it. You want to start small and start slowly. Your body has been through some big changes through pregnancy and delivery. It will need time to recover, even if you're feeling great after having your baby. Some of the factors you may want to consider include how active were you before you had your baby? How routine was your labor and delivery? Were you active throughout your pregnancy? Typically, we say that if you exercised throughout your pregnancy and had a vaginal birth without any complications, you can safely do light exercise almost immediately. Some examples of this might include walks around the neighborhood, modified push-ups, stretching, pelvic floor strengthening, this sort of stuff. It's a slightly different story after having a cesarean section delivery. A C-section is a major operation. It takes a minimum of 6 weeks to heal after a routine C-section. A C-section has major implications on the pelvic floor and the abdominal muscles. You definitely need to avoid lifting or any sort of exercise with any intensity until you have healed completely. You could start with walking, maybe some low impact aerobics, cycling, and then start to work up from there. If you start to do exercise and you feel any discomfort, pain, or a pulling sensation at the scar, then you need to take it back a notch. This is your body's way of telling you that you're not ready for whatever you're doing. This is not normal with exercise, and it's very important that you listen to your body. It's really important that we don't overexert ourselves. You need to have grace with your body. You just went through a major physical event. You need to take the time your body needs to heal. So what are some of the red flags and warning signs suggesting that we're overdoing it and that we need to modify our exercise routine? Increased fatigue for an activity that should not warrant that much fatigue. Feeling unwell during or after physical activity. Unexpected vaginal or scar bleeding. Muscle aches, strains, and pains. Breast lumps or tenderness. Some of the signs that you aren't even ready to begin exercise include diastasis recti, urinary incontinence or leakage, feelings of vaginal pressure or prolapse, pelvic pain, presence of tight scar tissue, and unexpected bleeding. Over the next few slides, we'll talk about 3 of the most important considerations when exercising after having had a baby. Number 1, paying attention to your pelvic floor. Number 2, if you are breastfeeding or pumping, there are some breastfeeding considerations to understand. And finally, ensuring your abdominal muscles have healed appropriately. Okay, let's start with the pelvic floor. This is the most common dysfunction in women after pregnancy. Your pelvic floor includes the muscles and ligaments that support your bladder, uterus, bowel, and vagina. You can see this here on the image on the right side of the slide. To help you identify these muscles, they're the ones that you might tighten to stop or to hold your urine. The pelvic floor can be weakened after pregnancy, especially if you had a large baby, pushed for a long time during labor, or had an episiotomy. And you can see here on the bottom image on the right, you can see a strong and healthy pelvic floor before childbirth. So that's the darker red muscles there lining the bottom of the pelvis area there. And then on the right-hand side, you can see that it's weakened and thinned out quite significantly after childbirth. Some of the complications related to pelvic floor dysfunction include urinary and anal incontinence, prolapse, and changes in sexual function. So let's start with urinary and anal incontinence or leaking. This occurs typically after vaginal delivery and could lead to urinary and/or anal incontinence or leaking. It often occurs when there's been 3rd or 4th degree perineal tears. Many clinical studies have attempted to discover the particular obstetric event that leads to incontinence. Obvious suspects might include having a large baby, difficult delivery, maybe lengthy pushing phases, or the use of instrumentation during delivery. However, there's been no clear single event that's been found to be responsible, suggesting that postpartum urinary incontinence could arise from a number of different physiological insults during delivery. Prolapse is when an organ, such as the uterus, drops down from its normal position. By far, the greatest incidence of prolapsing are after childbirth. Pregnancy and vaginal delivery are the risk factors cited most commonly. In fact, carrying the weight of a baby as it drops lower into the pelvic region, laboring to bring the baby through the birth canal, and pushing the baby out into the world combine to weaken the pelvic floor and create conditions for a prolapsed uterus. Harder labors and big babies also contribute to pelvic floor weakening. Delivering a baby bigger than 8.5 pounds can carry a risk of pelvic prolapse. Interestingly, symptoms of prolapse may not show up for years after an event such as childbirth, but when they do appear, are typically severe. And finally, changes in sexual function. Significant changes in sexual function, often related to genital trauma, are common after childbirth. Specifically, women with major trauma reported less desire to be held, touched, or stroked by their partner than women with minor trauma. And women who required perineal stitching reported lower intimate relation scores, which is a scale that measures postpartum sexual function, than women who did not require stitching. It's important to know and understand that you are able to return to satisfactory sexual relations despite childbirth experiences. Okay, so now that we've talked about some of the most common complications that come with pelvic floor dysfunction following pregnancy and delivery, we're now actually going to talk about some pelvic floor exercises that you could consider doing. This slide highlights some regular exercises that can help to strengthen your pelvic floor after pregnancy and childbirth. As we know, our pelvic floor may be adversely affected by pregnancy and childbirth, And therefore, continuing pelvic floor exercises immediately after giving birth could help to decrease the risk of urinary and anal incontinence or prolapse later in life. It's very important that you take care not to actually do more damage than help. And this can often happen when you're exercising too vigorously too soon. For instance, you want to be very careful of not lifting heavy weights or doing high impact exercises. Typically, when we do this, we might bear down or push down, creating pressure on our sort of pelvic floor muscles. It's kind of like the feeling of pushing out a poop. We want to really avoid this sensation because in actual fact, that works against us here on the pelvic floor, and that can actually increase our chances of prolapse. Often, many people consider visiting a pelvic floor physiotherapist or specialist, oftentimes before pregnancy and very regularly after pregnancy. Typically, if you would see a pelvic floor physiotherapist before pregnancy, it would be to work on relaxing or loosening those muscles in preparation for a delivery, most commonly vaginal delivery. And then to see a pelvic floor physiotherapist after having the child would be to start working on tightening and strengthening those muscles again that have been affected by the delivery of the baby. So what you can see here on this slide on the left-hand side in the graphic are some exercises that you might consider doing to help to strengthen that pelvic floor. You can see on the top left, we have assisted heel drops. Then we have dead bug on the top right, bridge on the bottom left, and finally bird dog on the bottom right. It's very important to have consistent and regular breathing throughout these and really trying to avoid that bearing down or pushing down sensation on the pelvic floor. In fact, we really want to focus on sort of holding it up or kind of tightening it up, contracting it, rather than pushing down on it. Okay, let's shift to some breastfeeding considerations when engaging in exercise or physical activity. It's a common myth that exercise will decrease a woman's ability to breastfeed successfully. This, of course, leads to a major dilemma for women who are breastfeeding or pumping and hoping to engage in physical activity. However, the good news is that studies have actually shown that vigorous or moderate exercise does not have an adverse effect on a mother's ability to successfully breastfeed. There's no effect on the volume of milk production, but this is provided that your caloric intake and your fluid intake is maintained, or better yet, increased. Some research does, however, suggest that if you do higher intensity physical activity, what this can do is actually produce lactic acid, and that starts to accumulate or build up in the breast milk. What happens is it then produces a sour taste to the milk, and many babies may not like this. If you're breastfeeding, you can prevent this potential problem by either sticking to lower or more moderate intensity physical activity and drinking plenty of fluids during and after your workout. A couple of strategies to consider to help decrease this lactic acid issue would be to try breastfeeding before you work out, maybe postponing your feeding for an hour or so after you work out, allowing that lactic acid to leave the sort of breast milk area there, or to express your milk prior to exercising. This can also make exercise actually more comfortable for you by decreasing the size of your breasts. Some other considerations with breastfeeding would be it's very, very important to have an appropriate bra that offers good support. We don't really want to rely on our pre-pregnancy sports bras because your back and cup size are likely different. They've likely changed and therefore won't provide the appropriate support or protection for your breasts. You also might consider wearing loose-fitting clothing to help with sensitive breasts during your workout. As we talked about on the last slide, you might consider thinking about the timing of breastfeeding, either feeding or expressing your milk before you work out. And this can help to avoid any discomfort that may come from really full or engorged breasts. And finally, as I said in the last slide, very, very important to keep your fluid levels maintained. So having a big bottle of water handy and taking several sips throughout your workout is very, very important. Okay, so let's move on to abdominal healing. Your abdominal muscles may have separated during pregnancy. Some abdominal separation is normal and expected with pregnancy. They usually go back to normal after the birth, but sometimes they can stay separated. Diastasis recti is when the rectus abdominis muscles separate during pregnancy from being stretched. You'll need to do exercises to strengthen these muscles to avoid back pain and injury. Common signs of diastasis recti during the postpartum period are a visible bulge or pooch that protrudes just above or below the belly button, or softness or jelly-like feeling around the belly button. You may see coning or doming when you contract your ab muscles. You could have difficulty lifting objects or walking or performing everyday tasks. You may have pain during sex, pelvic or hip pain, low back pain, poor posture, urinary leaking when you sneeze or cough, constipation, or feeling weakness in your abdominals. Several factors can increase your risk of developing and keeping diastasis recti. For instance, having multiple pregnancies, especially back-to-back, being over 35 years of age when having a child, having multiples such as twins or triplets, having a heavy or big baby, being extremely petite, and having a vaginal delivery, so that pushing can increase the pressure on the abdomen, leading to diastasis recti. To fix diastasis recti, you'll need to perform gentle movements that engage the abdominal muscles. Before starting an exercise program, be sure it's safe for diastasis recti. Working with a fitness professional or physical therapist who has experience would be a good idea. You can create a treatment plan to make sure you're performing the movements correctly and progressing to more challenging movements at the right time. Certain movements will make abdominal separation worse. During the postpartum period, there are some modifications that you should make. Very important is that you do not want to strain when doing any exercises. We sort of talked about this on one of the previous slides with the pelvic floor, that we really don't want to be pushing down or really pushing out and straining those abdominal muscles. The following is a list of exercise movements that should be avoided if you have diastasis recti. Crunches or sit-ups of any kind, planks or push-ups, unless you use modifications like wall push-ups, downward dog, boat pose, or other yoga poses where your belly is really being pushed out. You want to avoid double leg lifts, scissors, or other Pilates moves, and any exercise that really causes your abdominals to bulge, cone, or dome. You really want to do movements that help to pull the belly in rather than pushing it out. Okay, let's summarize what we've learned today. Exercising during postpartum is safe. We need to start slow and listen to our bodies. We want to watch for warning signs and red flags that we're doing too much too soon and make the appropriate modifications. We need to consider the postpartum specific factors that we talked about today: pelvic floor strengthening, abdominal healing, and considerations related to breastfeeding and pumping. Thank you so much for listening to this module.